Hi, my name is Rath Sundaram. I'm a consultant orthopaedic trauma and spine surgeon. I work at Gloucestershire NHS Foundation Trust as my NHS role, and I also work in the local private hospitals at the Nuffield and Cheltenham and the Winfield in Gloucester, and also at the Cobalt Centre at Linton House in Cheltenham as well. I've been here since 2010. And I love my job. I love coming to work. Okay, I decided to become a doctor a long time ago. That was in 1992 when I joined medical school at the University of Leeds. And the question is why I became a doctor. I love sciences. Okay, I love the anatomy, biochemistry, physiology, etc., and what we learned at school. And I wanted to apply that, okay, to study that in more detail. And with that, you can see the end outcome, okay, and the end outcome is to help patients, okay. And I like clinical work. I like talking to patients, and I like getting them better. So I like to use my knowledge, which I've developed over the years, to make patients' lives better, okay. And that is the essentials of being a doctor. Yeah, I liked orthopedics. I'm mainly a spine surgeon, but as part of that training, we have to do general orthopedics as well. Okay, and with the orthopedics here, we it basically covers the whole body. Okay, from the neck, the spine, the shoulder, elbow, wrists, hips, knees. It covers the whole body. Okay, and the anatomy really fascinated me, and I'm quite interested in sports. I play a lot of tennis, a lot of running. And it kind of all linked in for me, okay, and I really enjoyed doing that. And yeah, and that was the main reason. It's more musculoskeletal, which I'm kind of interested in. And in terms of spine surgery, is like I find that's the most fascinating out of all the subspecialties of orthopedics there. And it's quite. We listen to a lot of the patients. We take the history, and the surgery is quite challenging and technical, which I love doing on that. And the operation can last 2, 3, 4, 5 hours or so, or even longer, and it's absolutely fascinating. And we deal with all sorts of different problems, from like sciatica, spinal cord compression, from tumors, fractures, infections, and it's an absolute joy to see the end results when patients are quality of lives improved. Yeah, the most rewarding is helping patients at the end of the day. Is the patients come to see me, they trust me for my honest advice and opinion, and to help them along their way, okay. And when I can do that, okay, I can do that by giving them advice, okay. So like, and maybe advising surgery is not the best option for you, okay, or I said surgery is an option that could make you better, okay. And when we when we perform surgery, they're delighted, okay, and they get back to work, their function, they back to normality. They can mix with their friends and family. They go back to work. They can socialize and just get back to normal life. That is what we try and do, and that is so rewarding, especially when you get lots of good feedback from patients over on a regular basis. It's a great honor to be a doctor. It's a great honor and privilege to help people. I think what I value most about them is patients have a choice. Okay, it is important to have a choice. Okay, and they choose to see they choose to see me. Okay, and it's a great honor for that. Okay, and being a doctor is a privilege. Okay. And I'm honoured they choose to come and see me. They've done their research about me, and they believe that I can help them. Okay, so I do my absolute best on that. Okay, and I think when they see me, what they see me as it is. Okay, I'm quite straight to the point. Okay, and a lot of my reviews that people have said that I'm a very honest person. I tell it as it is. No messing about. No, come straight to the point. Okay, and they like patients like that. Okay, and they like that I'm really focused with them. Okay, and I have that interest at best at heart, and they also know that when I'm my outcome show I'm a good surgeon and a good clinician on that. Okay, and I'm deeply honoured and privileged. They have good faith and trust in me.